Hello, everyone, and welcome to the Dr. R Show. We'll be coming to your living rooms weekly to discuss various health topics with the help of medical experts in their respective fields. Meet my two very special assistants, Megan and Christina.
And I am so excited because today is leg day.
And then inhale as you lower back down.
They will be with me every week to give us tips on healthy eating and proper exercise.
Stretch and keep yourself hydrated.
So welcome to my show as we both learn together. Hi everyone, and welcome to the Dr. R Show. I'm delighted to be able to spend this time with you. On today's show, we'll be talking about your sinuses and why they can be such a pain. Sinusitis affects 37 million people each year, about 1 in 8. It is more common than heart disease and asthma, and as many of you know, it can make your life miserable. To help us understand this topic, we have with us today Dr. Stewart Thomas, one of the founders of Central Park Ear, Nose, and Throat in Arlington, Texas. Dr. Thomas, can you tell us a little bit about your education, training, and background?
Well, went to University of Texas at Austin, undergraduate. I actually grew up in Arlington, and then went to medical school at Southwestern Medical School in Dallas, and did my residency in ear, nose, and throat in Little Rock, Arkansas, University of Arkansas Medical Sciences campus.
And how long have you been in practice?
This August will be 21 years.
Now, when you started your practice, you initially joined your father, who's also an ENT doctor.
That's right. That's
That
right.
must have been something special.
It was a very unique experience. He was the first ear, nose, and throat doctor in town, so he had a group by the time I joined them. But it's a chance to re-meet or get to know your parents in a different way. It was a nice thing.
Now, did you ever get to do surgery with him?
We did. We would do some of the more complicated procedures together, and I would assist him or he would assist me.
Yeah, what a special treat that must have been.
Yes,
yeah.
it was.
And how long did you practice together before he retired?
He practiced probably roughly 10 years with us before he retired, and when we were together. So it's probably been about 10 years since he retired.
That's really neat. Yeah. Now, getting back to sinuses, what are sinuses?
Well, sinuses are nothing more than air-filled cavities in the bones of the face and the front of the skull, and they develop starting when we're in the womb, and that development continues gradually till you're probably in your mid-20s, and they arise out of the nose, and so they're all connected to the nose by definition. There are 4 pairs, obviously you have one on the right, one on the left of each one, and they're named based on their locations. And the ones that people are most aware of are their maxillary sinuses, which are in the cheeks. And they're aware of them because they're the ones that probably cause more pain than most. They are the largest, and they sit in such a way that the upper teeth protrude into those sinuses, and that's important because that's what causes the upper tooth pain that's fairly classic with sinusitis, and it's also how in certain circumstances a bad dental infection can cause sinusitis. So there are the ethmoids, which sit between the eyes, and they're actually multiple small chambers. I've heard some people compare them to a honeycomb, which is a good analogy. There are sinuses in the forehead that you know well about, the frontals, and then the sphenoids at the center of the head, also popular with the neurosurgeons. All of these sinuses are lined with a special epithelium called a mucous membrane. And they're called that because they're making lots of mucus, and there is a thin layer of mucus constantly moving across those membranes. I would compare that to the Everglades, a thin layer of water, and this is very important. The mucus is made by one of the 2 common types of cells in that, the mucus glands. You know, people hear the word mucus and they tend to be kind of revolted, but it's actually amazing stuff. Were it not for mucus, we would be a mess.
Only the ENT doctor.
Well, this is true.
Is cool.
We have a special love for mucus. But it is, you can imagine it as a type of constantly replenished, flowing flypaper. It catches particulate matter and bacteria and viruses, and it prevents us from inhaling them. Instead, we swallow it. A fun fact, we all make probably about 1 to 1.5 quarts of mucus a day and swallow it and are never aware of it. But it's a problem if you don't make enough of it. So then the other kind of cell in the mucous membranes are cilia. And cilia are microscopic hairs, and unlike the hairs on our head, these move. So you can imagine it's like a microscopic cat's tail, and there are millions of them in each sinus. And what's remarkable is that the cilia in one part of the sinus sweep in one direction, whereas the cilia in a different part of the sinus sweep in a different direction. And in both cases, they're moving mucus towards this small connection with the nose. So the cilia know where this natural opening is, and they're so good at what they do, they can lift mucus vertically. So for instance, in the maxillary sinuses, the bottom of the sinus is probably over an inch away from the natural opening, but these cilia will lift that mucus up out of the sinus and out that opening. It's truly remarkable.
So now, why do we have sinuses? What's their function? What's their purpose?
Well, in the end, we don't know. There are theories, though. And I think probably the leading theory is that they're there simply to reduce the weight of the head. You can imagine how much a head would weigh if it was solid bone. But there are others that believe that the sinuses act like the plastic bumper on the front of your car, like a crumple zone to protect the more important stuff that you take care of, the brain and the spinal cord and whatnot. There are those that believe that they're there to improve the resonance of our voice. And there's some that believe that they're there simply to help the nose humidify the air that we inhale. But we honestly don't know.
And what is sinusitis, and are there different types?
There are. It's a very broad general term, and what it means is inflammation of the lining of the sinuses and nose. And inflammation is simply the body's response to damage, and it's an attempt by the body to prevent further damage. And it involves the immune system and the blood vessels and also the local cells creating numerous different compounds to try to defend themselves from this. In the sinuses, inflammation is simply swelling, basically, and that's important later on because that swelling can become rather dramatic.
And what causes chronic sinusitis?
Well, we don't know, and we know that acute sinusitis is caused by swelling, in fact, there are two varieties of those. There's viral and bacterial, I would say that, and this is important, and I'd like to make this point strongly, that most of the time when we have a sinusitis, it's actually a viral infection, and probably doesn't need to be treated with antibiotics, and most of those are self-limited, but sometimes that can go on to cause the formation of a true bacterial infection in the sinus, and that's an acute bacterial sinusitis.
And how can you tell what kind of sinusitis you have?
Well, in the end, they all have symptoms that are about the same. And so classically, you can have facial pain. Sometimes one part of the face, the cheek, the forehead. Sometimes it's the whole face. You will get a stuffy nose many times. You can get discolored nasal discharge. And it could be, the color is immaterial. I have people that are convinced that yellow means one thing, green means another, but it really doesn't. And sometimes it's clear, honestly. A lot of people will describe thick drainage down the back of their throats. They'll have a sore throat from that. Sometimes the upper teeth hurt, like we were talking about with the maxillary sinus. And some will note that if they bounce up and down on their heels, the pain becomes much worse. All of these are symptoms you can see with any of the varieties, either acute or chronic sinusitis. But in the end, the difference has to do with the duration. And so if you have had any or all of these symptoms for less than 10 days, likely it is an acute viral sinusitis and really probably needs no therapy. If the symptoms have lasted longer than, some would say 7, I would argue 10 days. I think the American Academy of Pediatrics agrees with that. Then it probably should be treated with antibiotics, and you do have an acute bacterial sinusitis. And if the symptoms linger out beyond 3 months, and we say probably this is a chronic sinusitis, but there's more testing needed to be able to prove that.
Later in the show, we'll talk more with Dr. Thomas about the treatment of sinusitis and when surgery may be needed. Please stay tuned.